Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Dr. Tracy McCarthy, MD, is a board-certified psychiatrist and Institute of Functional Medicine certified physician with over 2 decades of experience. She is the creator of the Natural Mood Solution online program and the founder and medical director of Dr. Tracy McCarthy Functional Medicine, where she has supported thousands in transforming their health. Well, Dr. McCarthy, thank you so much for joining us. It's a delight to meet you.
Thank you. It's such a pleasure to be here.
I'm hoping you could get us started by telling us a little bit about how you got into the work you do and what drives your passion for it.
Yeah, I'm happy to do that. So I'm a conventionally trained MD and psychiatrist. And, I went into medical school because I had a passion for understanding why people get sick, what's going on in the body when that happens, and what can we do about it. And, the first few years of medical school were pretty satisfying, learning all this science and pathophysiology. But as my training progressed, it became more and more about matching clusters of symptoms to a label, a diagnosis, and then really matching that to a pill for an ill, as we say. And, of course, medications can be very helpful for people, but it was very limiting it was frustrating for patients. Ultimately, they found that wondered, do I need to take this medication for the rest of my life? This medication or medications often would leave them with a lot of side effects and not fully treat their symptoms. But the worst part for them and for me was this was not addressing whatever was causing the problem. And, I had really gone into medical school asking why does this happen? Why do we get sick? And that had gotten really sort of trained out of me ultimately, because when I'd ask, why does someone get schizophrenia? And they said, well, we don't know. And end of story. Now let's talk about what med we're going to give them. And fortunately for me, during my residency, unrelated to my residency, I really came across a lot of information about the role of inflammation. And I got really hooked on this. There's all this research out there and learning about the role of nutrition and lifestyle in how that creates inflammation and how that drives so many symptoms. But when I was first learning about this, I was seeing this in the context of like inflammatory bowel disease or autoimmune disorders. And I saw the power of it. I made changes in my own lifestyle and diet because of what I was learning just in terms of blood sugar balance and benefits from that. But I did still question, how does this work in psychiatry? Because I was still really stuck in that siloed model that we have where somehow the brain is totally separate from the body, which now, I laugh because how could I've ever thought that? But that was where we were. And in this process of going deeper, I came across the work of the Institute for Functional Medicine, and I was thrilled to find physicians applying this literature and this research to their practices. So I got trained, and, as I continued to work doing inpatient psychiatry, that was my career at the time, I realized I can't practice the way that I now know I need to practice in this setting. And so you took the steps to create a private practice. That's been an enormous learning curve, but very worth it because, now I'm in a place that's so different where I get to partner with my patients. We do detective work together to identify the root causes, the imbalances in their body that's always trying to heal, to see why are they having these symptoms? What can we do to address those root causes so that the body can be optimally healthy and they can feel great? And it's just a totally different world to be operating in. And it's so satisfying. And I get to keep learning. We just keep discovering so much about the different root causes of these chronic conditions. And they all have these, huge overlaps, whether it's depression or anxiety or bipolar or schizophrenia, in the world of mental health. Inflammation is at the root of all of this. And there's so much we can do about it. So it's a really wonderful, empowering place for patients to be, to see, hey, there's a lot you can do. You can understand your own body, and there's so much healing that's possible. So that's where I get to be today. And I'm so fortunate because I love my work.
Excellent. I have passion for helping people learn about what motivates them, what makes them tick, what gets them stuck, happy, sad, frustrated.
Mhm.
Because once they learn about that, then they're better equipped to make the decisions that only they can make in their lives. If I approach my interactions with patients through the filter of the DSM or the ICD, I don't get to do any of that, right?
Oh, true.
I'm just looking for a label and something to pair it with in terms
Yeah,
of a
that's the end
treatment
of
plan.
that's the end of the conversation, right? It's not satisfying.
So could you say a little bit about what you discovered in terms of inflammation related to mental health issues?
Yeah. I mean, it's so multifactorial. And, what I've really learned is there's all kinds of physical triggers. There's also emotional and psychological triggers. This is where our early childhood experiences and traumas, they have a role in this inflammation as well through our stress hormones, for example. But the role of the gut is enormous. That is houses a large portion of our immune system. And when our immune system is triggered, that's going to trigger that chronic inflammation that drives all these different symptoms we're talking about. And of course, these things manifest differently in different people because of our, uniqueness, our unique genetics and our unique experiences that are our epigenetics. So the gut is a big area of that. Toxin exposure is massive. I see a lot of impacts from hormone disrupting chemicals, mold exposure. These things aren't uncommon at all. And then, when I mention the gut, I'm thinking a lot about microbiome, but I'm also thinking about the ability to digest and absorb nutrients. So what we're eating, and then actually how much of that we're able to get into the body. That's a huge part of what I see every day in my practice, impacting how people feel. So a lot of different areas coming together, adding up in any one individual to manifest as their brain not working optimally and their body being inflamed.
And I have had several psychiatrists talk to me about their specialty being inflammation in the brain, mimicking anxiety, obsessive compulsive traits, depression. And like you just said, if you're not looking for the cause and you just start stamping out all these symptoms, you can see, I hope, the futility of an approach like that, because then you're forever just stamping out fires and adding more and more complicating factors to a system without understanding how the system works.
Yeah, you said it right there about adding more and more complicating factors, I think, because not only is it's sort of like playing whack-a-mole, you can't get everything, but you are actually, by ignoring and not addressing these underlying causes, they're getting worse. The system is getting more and more derailed. And then often the things we're adding to try to deal with these symptoms are further complicating the situation. And so, the beauty, though, of looking at the underlying causes is not only do you get a better resolution and the satisfaction of knowing you addressed the actual cause, but you usually fix a lot of other things going on as well. The things that are going to help your depression be better are the same things that are going to help you not develop diabetes. I mean, it's so broadly impacting. Yeah. So great. You win in every area. Exactly.
That's right. Well, because in a system like the one you're talking about, what my mind is telling me is what you're talking about is health rather than disease.
Correct.
And in the disease model, you're just not really caring about health. You're caring about eliminating symptoms.
Yeah. It's symptom management. Right.
Yeah. And, the other thing that popped into my head when you were talking about it, the various things that can contribute to inflammation, the mental emotional dynamics in a person. I do a support group in the past two weeks. We've watched the documentary on Dr. John Sarno. Are you familiar with Dr. John Sarno?
Yes. I came across his work a long time ago. I love the power of what he talks about.
And the dynamic that's available in the documentary that was done, and fortunately it was completed before he died, so he was able to see it and get some benefit from it. But I encourage people to go and just watch that documentary. It's available on alltheragedoc.com. All the Rage, because in his books he writes that the vast majority of back pain is the product of unconscious rage. And he coined the term tension myoneural syndrome.
Mm-hmm.
So if you get tension, mental, emotional tension locked in muscle fibers somewhere in the body, when they get tightened and spasming, activated, and they spasm, it reduces blood flow to tissue as little as 10%, and it's enough to initiate excruciating pain.
Mm-hmm.
Well, as they show in that documentary, my unwillingness to look at and process my emotions is the dynamic that causes all of that pain.
Yeah, we pay a big price when we do that.
And then what we do is we go take a pill or something to suppress the pain we're feeling, but we haven't done anything about the root cause.
Yeah, I think it's such a important concept. I mean, it illustrates the mind-body connection so well, and how it's so, there's so many pieces to that, right? I mean, your mind is perceiving the pain, but it's actually changing your physiology to create this blood flow issue. And then we know pain has this amazing ability sort of to take over the brain, right? It spreads to other areas of the brain. And I mean, just being empowered around that information, you can really intervene with yourself and start to see things differently and start to do things differently and actually turn it around.
Right. It's a game changer for a lot of people. You said, I don't know whether this is on our pre-interview talk or since we started recording here, but that you don't use that many psychotropic drugs in your work. So what do you use? What's it like for somebody to come in and see you as a patient?
Yeah, great question. When I start with a patient, I start with a pretty comprehensive lab panel, but also a really in-depth interview. I want to hear their story, and their story goes all the way back, because I'm looking at what were the exposures in their lifetime. You know, were they bottle fed, or were they born via cesarean? Even these things matter for the health of the gut. We go all the way back, asking about their environment growing up, what was going on with their family, you know, what were they eating, what were the emotional situations when they were a kid. But so getting their story and looking at what were the factors that I think might have had a big impact to lead them where they are today. And then the lab panel is going to look at the stool test so we can really evaluate their gut health. I also use the urinary organic acids test, which tells me more about the gut and nutritional status, and also their cellular energy production and their mitochondria. And then a blood panel looking at inflammatory markers and hormones and other nutrients and many factors. And that's a great broad net to start with, where I can start to see imbalances. Where are we needing to focus? Is this a lot to do with blood sugar? Is there an autoimmune picture going on? You know, is there a real big imbalance in the gut in terms of bacteria that are overgrown? Or is there even like a parasite? Those aren't rare. We see those a lot. Is there a toxin exposure? So that's where we're beginning. And, you know, of course, I want to get someone symptomatic relief. And there's often pieces of the puzzle that are missing that will provide some quick symptomatic relief. Like maybe they don't have any magnesium, for example, or their zinc is low, or the B vitamin situation is bad, like they're missing B12. And things like that can make a rapid shift already in their functioning and how they're feeling. And there's a big focus on what is going on with their lifestyle. Are they sleeping? We begin with the food. Where are they eating? You know, where are they now with their eating? We meet people where they are and then start to baby step our way into a healthier anti-inflammatory diet, a diet that's going to stabilize their blood sugar, provide the nutrients they need, give them the energy they need. And, you know, these are the things that help people start feeling better really quickly. And so that's why we often aren't needing any kind of medication at all.
Yeah, I've seen it so often in my personal life and in my caseload over the years, that you tweak a little thing that's related to the actual cause, and the ripple effect through this panoply of symptoms that they come in with it's amazing.
Enormous. Yes, agreed.
Whereas, you know, if there's a lot of debate going on these days about the medications from people who are starting to question it. And so then I'll get the kind of aggressive question from people, well, are you telling me that all medication is bad and I shouldn't take any medication? And I am quick to say, no, that's not what I'm saying at all. I will, however, say that if you're on 5 or 6 or 8 medications, all related to what your psychiatrist has given you or your family practitioner gave you, and then the psychiatrist added to, for the symptoms that you're trying to relieve, and you still are coming in to see a psychologist because you're miserable, something's not right there, right? The
Agreed.
polypharmacy issue and the ongoing polypharmacy issue isn't getting at any cause level intervention.
Exactly.
And how often do you see people and where you're not the first doctor they go to?
Oh, I'm never the first doctor they go to.
Okay. Okay. Can
Yes.
you talk about that? What's that like?
Gladly. Well, I mean, I think it's the nature of what I do. I have a private practice. It's outside of insurance. It's not usually what people are looking for first. The reason though, people come to me when they're stuck. And I think that's true of a lot of functional medicine providers. They have been, banging their head against the wall with the conventional system and not getting anywhere. I will certainly see people who may have gotten a partial benefit from a medication. Maybe they've gotten a lot of help from therapy, but there's still certain really frustrating symptoms that are going on. And maybe things are getting worse in multiple areas, right? It's not just their depression. It's also their irritable bowel syndrome. It's also their fatigue. Like a lot is happening. And they get dismissed, frankly, by a lot of their doctors. There's really terrible amount of gaslighting that goes on. I mean, I hear really bad stories, and not everybody has a doctor like that for sure. There's some wonderful primary care doctors out there, but there's just a lot of like, your labs are normal, you're fine. I'm like, well, you're not looking at the right labs here to see where the problem is. So people are feeling stuck and hoping that there's still a different way and a better way. So they come to me kind of, with that guarded hope that maybe it could be different. And, my first job is to validate them and say that, yeah, I hear what's happening and it is happening. Something is wrong. I don't know yet necessarily what it is. I have some ideas. We're going to look, we're going to keep looking, and I'm going to partner with you in that. And that right there is such a different experience than they have, that is fortunately already therapeutic, because we're in an alliance.
Exactly. And so then what do you do if somebody comes to you and they're on 3 or 4 or 5 medicines already?
Yeah, great question. So, I mean, I'm very, like you said at the beginning, you're not against medication. Neither am I. Medications are just tools, and some are really good tools and some are really poor tools. Meds are not all created equal. Unfortunately, in psychiatry, a lot of our meds aren't really great. They either aren't very efficacious or they carry a lot of side effects, or sometimes both. And when people come in on a medication or multiple medications, I'm looking at first, I don't want to stop any medication right away unless it's causing a lot of side effects, because often they're going to feel worse as they peel those medications off if we haven't addressed any of the root causes and help them be in a state to do well with a taper of medication. We're really trying to optimize neuroplasticity. And, we've got this hardware, the brain, that's running all our software, all our thoughts, and we have to have functioning hardware. And we can make changes, we can adjust to coming off a medication much better when that hardware is healthier. So providing the neurons the things they need, like the B vitamins, like omega-3 fats, lowering the inflammation, these things, a few months of that kind of work can make coming off a medication vastly different and much easier. And then, of course, it's about doing things cautiously and one at a time. And, what's the thing that's maybe causing the most trouble? Maybe there's something that's really causing weight gain or insulin resistance, and we don't need that anymore. We can get rid of that. And so, picking wisely what we're going to take away. And then I often work with compounding pharmacies for patients to set up really slow tapers of medication, because again, we aren't trying to shock the brain. We're trying to work with it and have it adapt and not be overwhelmed or threatened by a change we're making.
And so in an approach like that, it seems to me that you're going to be much more likely to avoid the problem of assuming that adverse reactions to coming off a medication are an indication that they need more of the medication.
That is the classic for antidepressants, isn't it?
Yeah. And, people like Dr. Peter Breggin and he wrote a specific book on how to come off of these medications. And it's involved, but one of the key things, and when I interviewed him, they just zeroed in on the idea that it's most important to pay attention to the individual's experience, because some people can cut it in half and then cut that in half and be done in 4 weeks.
Correct.
But others aren't even close to being able to do that. And
No.
I'm assuming that it's responsible for all those factors you just mentioned are responsible for that. If the brain is missing nutrients, and if it's, if you're not paying attention to the person and the other stabilizing factors in their life.
Yes. And I would add to that, I think there's also there's a limbic brain piece of the puzzle too. I know you recently had Dr. Caroline King on from Primal Trust, and I was enjoying listening to your interview with her, because this is a thing I think is really important for patients, the brain retraining part of things. And that is, what is your feeling around the medication? What is your fear of coming off of it versus your desire to come off of it? If this is what I meant about, like, if it's a threat, if it's scary coming off of it, that's something we have to work on also, because your limbic brain is going to really be scared of this change. It's just trying to protect you. It's doing its job. And if it thinks it's a danger, that's going to really promote having a lot of symptoms. So, what's a rate that feels good to the person? I really like to ask someone, what's their intuition around this? Like, what feels like a decrease that doesn't feel scary? Because I think if we can go in with something that's just not scary, our chances of it going well go up astronomically.
And it works the other way.
Yes.
For years, for decades now, I've worked with people and they're just a wreck in anxiety. And they keep coming in, and we do what we can in the therapy. And they say, well, do you think I should finally, break down and try a medication? And I'll say, well, you could if you want to, but here they are. This is a panic attack. Here's where normal people live their lives. The highly anxious person is here. If they're afraid of taking the meds and they're just below and then the meds do a little bit of work, they're right back where they started, or a little bit better, or a little bit worse.
Right.
Just because of what you just said, the limbic system, their own fears, create such a dynamic response within the brain that
it's so powerful.
You have to pay attention to that.
Yeah, because it's running your physiology. The brain is in charge. And that's why I loved what you said about, the individual. You have to take into account the individual, because like, their feelings around it are very important. So that's part of my, when I set up a tapering plan, or, our initial tapering plan, it may totally change as we go. It's I will suggest something, but how do you feel about that? Does that feel like too much? Is that scary? Does that feel like really easy? I always tell people, if it's a laughable amount, it's so little that it's laughable, then that's great. Because if you're laughing, you're not scared of it.
Yeah. I just flashed on a book titled May Cause Side Effects by Brooke Seam. And Brooke was 30 years old, or a little over 30 years old, and contemplating ending her life by stepping out, high story window. And she caught herself and thought, well, wait a minute, what about all those medications that are in the medicine cabinet that I've been taking all these years? What if I went off some of those first, and then if I was still depressed, I could. So she went to her psychiatrist, and the psychiatrist said, yeah, I guess you could do that. So she went off cold turkey.
Wow.
And it was brutal, but she was very bright, very creative, and turns out to be a good writer. And over the next year, she chronicled what it was like. And she chronicled what she learned about things like hyperbolic tapering and things of that nature. It's a wonderful book, wonderful story. And it just highlights the other side of the, we don't want to be doing that to people, right? We don't want people coming off of these meds so rapidly that their world is falling apart and they feel like, they can't survive.
And just to get back to what you said earlier about that's often shown as proof that they needed to be on the medication. And I think that's so, I really hate that. It's so disempowering to people, and it's so sort of pathologizing when it's like, this is a the political term is discontinuation syndrome. It's a withdrawal syndrome. So, they need to know that that's what's going on. Their brain was adapted to this medication. So we take it away and it's got to readapt. And that's not because something's wrong with them.
Well, and that's the other thing, is that there's this myth that started with the psychiatric profession, but now it's out here in the general population. And the myth is that you're depressed because you don't have enough serotonin or dopamine, and that there's an imbalance of the chemicals in your brain. And when you add this chemical, name your antidepressant, then you get a balance and things are restored and you're healthy again. It was never proven. Correct me if I'm wrong.
No, it's been very disproven.
Yes.
But that, hasn't really gotten out to the general public well enough. And people still think in those terms. Kind of like how, this issue of cholesterol in our diet was a big thing in the 80s, and that's been totally disproven, but still people are walking around concerned about their cholesterol intake. It's like, it takes a long time for these things to get dislodged from the psyche.
Well, and the other thing about, I don't know that this is true, but I'm assuming based on the behavior that a lot of psychiatrists are still assuming that if the patient gets depressed on this medication, it means we have to try another, or if they get worsening symptoms when they withdraw, they have to go back on it and maybe add another. It seems that they're functioning under the belief that people are only depressed because they don't have enough of these drugs in them.
Right. It's a Prozac deficiency. That's the illness. Right. Well, I really think that's just a function of the system and the training. I mean, most of these people are very well intentioned, right? And they got into this to help people. But when, your only tool is a hammer, everything's a nail. It's a limited toolbox, and it's the way the training was. I mean, I was in it. I was trained that way. I feel so fortunate that I got my mind opened and broadened, because now I can see it, for the limited approach that it is, and really pharmaceutically driven approach that has not got human beings and their physiology at the center of it.
Something about what you just said brings up a question for me. I don't think I've asked this one in years. Are there some books that you recommend to your patients to start to open up their awareness of these issues?
There's so many good books, actually. I don't know that this isn't specifically about mental health, but I'll tell you a book that really changed my life. And that's by Dr. Weston A. Price, who was a dentist in the 30s, who did all this research. And he traveled the world with his wife as his research partner, studying the rates of cavities and malocclusion, which is like, these days that would mean you'd need braces, in all of these different peoples in different areas of the world that had not yet incorporated a Western diet. And this was like in the Maasai in Africa, and like Inuit people at the North Pole, and people in the South Pacific and Peru, like all over the world. It's called Nutrition and Physical Degeneration, this book, kind of a old-fashioned name. But I'll tell you why it was so important to me. When I read this, it really shifted my whole paradigm, because going to medical school, and hearing about all these terrible illnesses that could befall one, I just remember thinking, gosh, I hope I don't get that. Like, we're just waiting for the shoe to drop, that you have this sort of destiny based on your genes, and that's it. And, it's sort of like illness is inevitable. That was basically how I felt. And, the concept is of a war. You got to wage war on cancer. It's a battle mentality. When I read this book, it really, really brought home to me the concept that we are meant to be healthy. We evolved just like all other species evolved. And when we're doing the things that make sense for us, like that we evolved doing, like we have the right microbiome that we co-evolved with, we have the right light exposure, we're in communities that we evolved in, we're active, we're eating natural foods, things work really well. We don't get cavities, we don't get malocclusion, but it's not just that. They don't have, like, hunter-gatherer tribes did not have the chronic illnesses we have. Yes, they died of traumas, but it was a very different picture. And that, to me, shifted everything, because now I look at things from that lens. Well, okay, what is the body needing to heal that we're not giving it? What's blocking its healing? That's how I'm looking at things. And it is a great book for anyone who's interested, because there's all these pictures in it, and it's just a very cool story of all these different peoples all around the world.
So one more time, the title and author, please.
Yeah, it's called Nutrition and Physical Degeneration. And it's by Dr. Weston A. Price, DDS. He was a dentist.
Excellent. Is there another that you would offer?
I'm looking over at my bookshelf that's full of books that I love. Let me think about that for a second. I like Jeffrey Bland has one called The Disease Delusion that's quite good. Kind of hits on some of the things we've been talking about. Some things I ask patients to read to get them to understand the power of food is a simple book called It Starts with Food. That's been out for probably over 10 years. It's a really great, short, easy read, but you begin to see the power of what you're eating. Often that's a great place to get people started.
And I like The Biology of Belief by Bruce Lipton, because it talks about how you were alluding to this earlier, that there was a model that said that the primacy of DNA, meaning that the DNA is first cause for whatever we grow into and process. And I believe he is still recognized as the father of, metagenetics, right? This epigenetics of what these other factors that either turn on or off the genetic code.
And so much more important. Yeah, I love that. That's a great example. And that's what I'm always trying to help people understand. Genetics are really important, but it is often like 10% of the puzzle. It is the epigenetics. And to help people realize epigenetics is sort of everything we're doing all the time. And we can influence that a lot. And we can't go back in time and change how we were born or what we ate when we were kids, but what we can do now is still very powerful, and we can heal so much in terms of epigenetics.
Another big question that I get from people is, okay, if I'm going out and I'm trying to find a practitioner, what should I be looking for? And what's the difference between functional medicine and integrative medicine and holistic medicine? And
yeah, these are complicated or confusing terms. I think functional medicine in particular is a confusing term. The way I think about it is integrative medicine is integrating different modalities and, looking at, I think of an integrative medicine as someone who is conventionally trained, who's then maybe incorporating ideas from Ayurvedic medicine or Chinese medicine, often lots of mind-body techniques. Food, of course, is important. And many of these people, this is an overlapping Venn diagram for sure. There's functional medicine people who are very integrative and vice versa. But at its root, functional medicine is about uncovering root causes. And so it's that detective work. We use a lot of integrative tools to do the rebalancing of the imbalances we find, because that's what works. Food and meditation and sleep and the right nutrients. But it is about, I think a lot of times in functional medicine, doctor will use much more lab work than a lot of integrative doctors. But like I said, there's plenty of integrative doctors that are pretty functional. So it's not black and white, but it's, we really like to do that investigation.
And you mentioned another thing, which is a real roadblock for people, is that their insurance doesn't cover a lot of the work that might actually be corrective or healing. So do you see anything changing in that area? You
That's
see
a great
any
question
inroads that might be allowing insurance companies to get on board and pay for the kind of work you do?
Well, I have to say, I put my hope in some of the people I know doing studies on this approach. And it's not easy to do because you can't, a randomized controlled placebo, double-blinded trial is not going to work on this approach, because you must actually work on multiple variables to get the results. That's actually what makes it effective. But it's not going to be sponsored by a pharmaceutical company. But there's a Center for Functional Medicine at the Cleveland Clinic that was co-founded with the Institute for Functional Medicine that has numerous studies that are completed and are ongoing, looking at this personalized approach, and they're showing better outcomes, less costs to patients and to the system, and showing the validity of this. And I think it's studies like that will eventually get insurers to pay attention, because I think in the end, it's going to have to save somebody money for them to be motivated. Dr. Terry Walls is a wonderful internal medicine, functional medicine doctor who is also doing studies in this area on multiple sclerosis. She has multiple sclerosis herself and is an amazing recovery story. Two colleagues of mine locally, Dr. Christine Burke and Dr. Kat Toops, are involved in Dr. Dale Bredesen's reversing cognitive decline studies, which are just phenomenal, the work they're doing there. So again, I think it's the studies showing the money savings and the efficacy, because what they're doing with cognitive decline, for example, no drug has ever done that. Nothing's ever reversed it. So that's one piece of it. But I think the other piece is everything that, like what you're doing with your podcast, as people become educated and become aware, there's more and more demand for this kind of service. I've certainly seen my alma mater finally have an integrative medicine clinic, because it's a thing that patients want. And, they are competing for those different insurance, groups to partner with them. So there is some of that. I mean, it is disheartening. It's slow. The system is so designed to be like these little short visits that don't work for functional medicine or integrative medicine, and very pharmaceutically driven. But I do have hope about the studies. And I think the more that people know and ask, the more we have a chance of changing the system.
And I think it's important for us, from the overview perspective, to understand that the system has changed a lot in the last 50 years that I've been in it. Mm-hmm. Because when I first got into the system, psychiatrists did the therapy.
Mm-hmm. Yeah, that's really changed.
And the psychologists did the testing.
Mm-hmm.
And I watched this shifting of turf. It was a turf war. And then in the 80s, the dramatic flip that happened when the managed care companies came in, and it became all about who can cure patients in the least number of sessions.
Yeah, cure.
Right? That was it. I can cure that person in 10 sessions. Okay, I can cure that person in 5. Well, we've got great therapists. They can cure that person in 3. I kid you not. These actual... at one point, I had people that wanted me to work for them and do half-hour sessions, and they would pay me, a pittance. But if I didn't get finished results with the person in 3 sessions or 5, then I had to go back and try to justify getting more sessions.
Yeah, I had that experience in the hospital with peer reviews. Sometimes if patients not getting better, why? And the system is enraging. It's like, have you worked with people and understand how therapy works? They don't get it. But it's just about the dollar.
Right. But through that process, what they did was they actually flipped, and they, meaning the purse holders, the insurers, flipped the script so that they would pay the psychiatrists more, a lot more, but then they would only pay them for doing script writing and monitoring the meds.
Right.
And they wouldn't pay them for doing the talk therapy. So then there was this hole, and the psychologists came in and filled it nicely. And so my point is that the system has always been changing. And I think it's quite hopeful to say, if we keep talking about what needs to change and bringing pressure to bear from the grassroots up, right? If people say, look, I'm not just going to take a med. I'm not going to just get plugged into this machine you have going where you're making a lot of money off me taking these prescriptions. I want to find out how I can live a healthy, joyful, fulfilling life. And that's not contained in a pill.
No, I think, part of the problem here is too that this is happening in all other areas, not just mental health, right? Like diabetes care, for example. I mean, these things are breaking the bank. People are just getting sicker and sicker. But the answer to all of it is the same, working on these fundamental aspects of human health, lifestyle, nutrition. But they got to talk to each other, these different silos. The system is still so fragmented. I don't know what it's going to take because, this chronic healthcare burden is going to bankrupt us eventually. So something's going to have to change.
Well, I realize we're getting close on time here. I wonder if you would just get centered and take a breath and think about whatever we've already talked about, if you want to go back and highlight one of those topics, or if there's something we haven't even touched on yet, you want to make sure to get in before we finish.
I think for me, the message I really would hope people can receive is that there are so many things you can do just as baby steps, one at a time, to really start to feel better and to help your overall health. And these things will help your mental health. And that, a lot of this begins with things like reducing processed food, thinking in terms of feeding your microbiome rather than ignoring it. It's like an organ, what fiber am I giving it? What colorful fruits and vegetables? That these simple things can have a massive impact. They add up over time. And I think it's a hopeful message. And it's not to make anyone feel bad that they're not getting themselves better. That's not what I mean. But to be empowered to take some action and know that you aren't just reliant on someone who's giving you a pill. And, that's the end of the story in terms of the physical components of your mental health. I'm a huge proponent of therapy. And, but that's also not going to solve someone's B12 deficiency. So I want to make sure people attend to these, what I call like overlooked causes of depression, anxiety, and brain fog, and know that there's so much hope there.
Excellent. Well, thank you so much for joining us. And if people want to find out more about your work, where do you direct them?
I think the best place is to go to my guide, The Top 10 Overlooked Causes of Depression, Anxiety, and Brain Fog. You can find that at drtracymccarthy.com/top 10. That's TOP and then the number 10. And you can download that for free and start there. I think that's the best place to get started in learning about what I'm talking about there.
Excellent. Well, thank you so much for joining us. It's been a delight. And if you get around to writing a book or another top 10, please let me know and we'll have you back for another conversation.
Thank you so much. It's been a real pleasure to be here.
Dr. Tracy McCarthy, MD, is a board-certified psychiatrist and Institute of Functional Medicine certified physician with over 2 decades of experience. She is the creator of the Natural Mood Solution online program and the founder and medical director of Dr. Tracy McCarthy Functional Medicine, where she has supported thousands in transforming their health. As a wellness thought leader and in her practice, Dr. McCarthy is dedicated to helping adults suffering from depression, anxiety, brain fog, fatigue, digestive issues, and hormonal imbalances by identifying and addressing the overlooked causes of these chronic symptoms. Her approach focuses on underlying issues including mold toxicity, microbiome imbalances, nutrient deficiencies, and in empowering her patients to regain their health and vitality.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.